Desai with Kansas City University answers our questions about opioids and how you can keep your kids safe. All right, thank you, Nick. Well, despite recent efforts to combat opioid abuse, we still have a major problem with addiction and drug overdoses, especially among young people. We've done lots of stories recently. Well, Dr. Desai with Kansas City University joins us live again this morning with what we can do about this. Good morning to you, Doctor.
Good morning, Kim.
So why are we seeing children turn to these drugs? They're so dangerous.
They're very dangerous, and last year we saw, a spike in overdose deaths. We had people that are trying to treat themselves for stress and anxiety because it's just been a very stressful time. So that's one reason people are self-medicating. And then just as we saw in the 1960s, people are experimenting, but with much more lethal consequences. Sometimes they'll see that their friends are using these, and sometimes they'll just see it in the media. So a lot more people are turning to these now.
Okay, speaking of the media, let's talk social media, because kids are actually finding drugs through social media.
They are. You don't have to be a computer hacker. You don't have to use the Onion router. If you can just go on apps, you can find drugs for sale, even on apps that are just used for fun, everyday purposes like Snapchat and Instagram. You can communicate with people who are trying to sell the drugs by using messaging apps like WhatsApp or Kik. And then you can pay for those, with your cell phone by using an app like Venmo. So if you have a smartphone and connected to the internet, you can probably find drugs fairly easily.
So we've reported on kids here in the metro dying because they took one pill they thought was harmless. It turned out to be, a deadly dose of fentanyl. What is your advice to teenagers and to parents and younger kids too, who really think, this is no big deal, it's one pill?
Yeah, the stuff that you find on social media is not made in a safe lab. It's not tested. So you can literally die with just taking one pill, no matter what the claims of the person dealing it online are. Every day, 136 people die of an overdose. Last year, we had 93,000 deaths, which is an all-time record. And these are probably on the lower end of what's actually happening. So parents should talk to their kids starting at an early age and just seeing if they are stressed or are anxious or anything, and then find a safe way to deal with it. And then just convey that message that, it's not safe if you're getting it off of social media, and even meds from a pharmacy can be unsafe as well. But you really just need to talk to your kids. There's a good video called Dead on Arrival, which is very hard to watch, but it just there's many parents who found their child dead, just trying to give that message to other people, other parents, other kids.
And any prescription medicine that's not prescribed for that person, you shouldn't be taking it, even from your own family medicine cabinet at home.
That's correct. That's correct. They did a survey and they found that nationally, over half of people aged 12 and over, if they are misusing prescription meds, they got them from home. In Kansas, that number was closer to 75%. So if you do have any meds at home, you want to keep them safe from pets and your kids. So you want to make sure to lock those up.
All right. Doctor, thank you so much. Great advice as always. We appreciate you.
Hey, thank you, Kim. Have a nice week.
You too.